Good evening, everyone, and welcome to our live stream tonight. My name is Jack. I'm a paramedic team manager with Ambulance Victoria, and I'm very excited to be joining you in your lounge room tonight or wherever you're joining us and dialing in from. We're very excited to be here in conjunction with our friends at Hatzolah in this exciting campaign that Ambulance Victoria is running in the month of October, which is very aptly named Shocktober. Every year during the month of October, we have a day which is called Restart Heart Day. And on this day, part of our focus is bringing the community together and helping share the skills that can enable the community to help come together and save a life when someone suffers a sudden cardiac arrest in the community. Obviously, this year we've been challenged with the COVID pandemic and coming together as a community has been a bit hard. But as I said, our friends at Hatzolah have very kindly joined with us tonight to stream this broadcast out to you in the community. And we're very excited to be able to share this community education campaign with you. I'm joined tonight by my good friends John and Leon, who will join us shortly, and together we're going to talk to you about our Call Push Shock campaign, which is all about using members of the community to help us as first responders to save lives in cases of sudden cardiac arrest. Our session tonight's going to go for about 30 to 40 minutes, and there's an excellent opportunity at the end for people to ask questions. So as we're going through the presentation tonight, please type your questions into the forum, whether you're on Facebook or Teams. We've got the team sitting at the desk here and they'll pass the questions along to us at the end, and we'll be more than happy to answer any questions that you've got. And of course, it wouldn't be a live stream without a free giveaway. And so we're going to choose the best question tonight, our favourite question that gets the best response, and we've got a little giveaway pack to give to that person who asked that question. So please, there's a little incentive, jump in and give us your best questions, and we'll be only too happy to answer those at the end of the session. As I said, this is a community education campaign, and it's really all about giving you 3 simple steps that can help you save a life before emergency services arrive. John is going to speak to us now just briefly to explain a little bit about what the chain of survival is and why it's so important that we have members of the community involved in our effort to save lives in cardiac arrest. John, do you want to tell us a bit about the chain of survival?
Thanks, Jack. Welcome, everybody. My name's John. So the chain of survival, why do we use that as a great picture? Because I think everybody understands that the strength of a chain is in the links. So, and also where do you fit in? And the importance of this chain of survival is that we maintain those links, and together with you as bystanders, we as Hatzolah and Ambulance Victoria, we can make a huge difference to the survival rate of that patient. The first link is actually recognising what the issue is, followed by very quickly the second link, which is get on the phone and get help. Then early CPR, then defibrillation, which we'll be demonstrating shortly. The ambulance service arrive with their expertise, and then of course finally at hospital. So joining all those links together makes the huge difference to the survival rate of the patient. Every minute that's delayed with CPR, for example, reduces that person's chances of survival by 10%. Now, it doesn't take long for the minutes to stack up. So where do we fit in as a bystander? As you can see from the picture, your role is right up to defibrillation. So once again, recognising that the patient needs help, calling for help, starting CPR early, so that's the push, and then defibrillation, which is the shock. Our Hatzolah, of course, can be called along with that, and we'll assist with CPR and the shock, followed by ambulance with their expertise and their crews, which will then transport under great care to hospital. And the outcomes these days with this sort of chain of survival make a huge difference. And the important aspect of it is that you can make a huge difference.
Thanks, John. Great point. We know that in modern medicine, we've made huge advancements in recent years with the care that we can deliver in hospital and all sorts of exciting clinical changes that have come into how we can look after you in the community. But at the end of the day, as John's highlighted, we can only have great outcomes in cardiac arrest when we have all the links joined together. And that really starts with recognising and responding as early as possible. And so that's where we need the support of the community to come in and join us in this journey as we help improve our survival rates with sudden cardiac arrest. So in Victoria every day, there's dozens or a numerous number of cardiac arrests that occur out in the community. This equals hundreds of cases every single year of sudden cardiac arrest. What's important to know is that sudden cardiac arrest often happens in the home or around workplaces and other times when we're around people that we know and trust and love. What's really important is that when you come across a cardiac arrest and you're in this environment where someone is suffering from a cardiac arrest, we have to be able to recognise this early and start the treatment. The typical survival rate from a cardiac arrest that occurs outside of hospital is around 10%. So that means just 1 in 10 people survive this type of medical emergency. But what we do know is that when we have the early intervention and the chain of survival is all brought together, we can increase the chance of survival to a much, much higher percentage. And so that's why it's so important that we have our community educated and ready to respond when we have a case of cardiac arrest.
I was playing soccer and I felt really dizzy.
My legs just gave out from under me.
I was turning blue and I had no pulse.
And then I had a cardiac arrest.
They tried to revive me and they couldn't,
Someone got a defib.
and started CPR.
The defibrillator restarted my heart.
If those guys hadn't been there, or if they hadn't been able to get a defib, I wouldn't have survived, that's for sure.
So these are some of the stories that we've heard, and these aren't just actors or a commercial. These are real life stories of lives that have been saved through excellent interventions that have been performed by the community. And so what we know is that we can have the best ambulance service in the world and the best first responders in the world helping us out, but without the link of having the community on board, we can't achieve these great outcomes. And so really to have more positive stories like these, we need the community to come on board with us and to be ready to step up when a case of cardiac arrest arises within your local community or your friendship group or even your family. So let's talk about how you can actually help. Well, it's simple. The days of complex resuscitation efforts and complex first aid training are over. And really what it comes down to now is 3 simple steps that you can implement and remember to help us save a life. So here's the things. When you recognise that someone's in trouble, the first thing to do is ensure that it's safe. Once we know that it's safe, we need to identify what's going on with the person. If we know that a person is not conscious, that is that they're not responding to us, and we notice that they're not breathing normally, then it's really important that we start to enact our call, push, shock system so that we can provide the life-saving care as early as possible. So there are 3 steps in our campaign, and they're nice and simple, but we're going to step through them tonight with our expert presenter, Leon. And we're going to break them down and really hopefully share with you guys out there in the community what you're looking for and how you can help. So I'll hand over to you, Leon, if we want to go through these steps.
Thank you, Jack. And the first step is call. The number that everyone knows is 000, or call Hatzolah 95275111, or you can use the brand new G-PAP, which we'll touch on in a second. But remember, when you call, one absolutely fundamental, really important thing is that you know your location and you communicate your location clearly. When an emergency has happened, when a person has collapsed, when you're worried someone is dead or dying, you become panicked and you want help as quick as possible. However, if you don't tell us the location, if you don't tell ambulance the location, we won't know how to find you. We won't know where to go. Especially if you're in an area like a shopping centre, a school, if you're in a park, if you're on a beach, you need to find really clear signs to identify where you are. And the other thing is send someone to greet the ambulance, send someone to greet Hatzolah. It's vitally important. If we can't find you, that wastes absolute critical minutes. So just a bit on the G-PAP. So Jeep stands for Jewish Emergency App. You can download it from Apple Store or Google Play, and so Apple and Android. It gives you instant access to Hatzolah and to CSG, so the community security group. You press in the case of a medical emergency, you press the Hatzolah icon, hit the call button, and it will call Hatzolah's number. What it also does is if you have registered for it, it will send us an email that details your location, or at least very close to your location. which means that if someone collapses or is unable to communicate and get their location across or their phone number across, we receive at least almost pretty much accurate information. So it might be one house or two houses away, but at least we know around where to look. That's call. The next bit is push. So just to briefly describe what you do with pushing, first thing is, especially in these COVID days, is to put a mask on yourself and to put a mask on the patient. So your safety is number one. First thing you do is you put a mask on yourself and a mask on your patient. You then kneel down about a foot away from the patient. You put your shoulders directly above the patient, lock your arms straight, your two hands nipple line in the center of the chest, and just start pushing. It's not a gentle process. It's not a nice process. You'll probably hear a crack, crack. That is okay. You need to be pushing deep. You need to be pushing a third of the way down and pushing fast. Now, I've never been a song guy in this context, but if you do want to have a bit of a rhythm, Staying Alive, or if you want to be a bit more modern, Baby Shark, but whatever it is, something nice and fast, so hard and fast. You're really looking for around 2 compressions per second. So it's very fast and you're going to get very tired very quickly. We have Casey, who's going to help us demonstrate. Thank you, Casey. So you're going to kneel up straight, your shoulders above the person's torso, heel of your hand in the center of the chest, nipple line. Don't worry about being exact. You want to be the lower half of the chest, nipple line, center of the chest. One hand on top of the other. Lock your fingers together and push down hard and fast. When you push down, try to recoil as high up as you can without bouncing off the chest. So hard and fast, around the 2 compressions per second, and just keep going. Now, if you're fortunate enough to have Jill close by with a defibrillator, you keep your compressions going. This is the shock bit. So we've done call, push, now we're up to shock. The person with the defibrillator, the person who's doing compressions, continue with the compressions as the person with the defibrillator starts to prepare. First thing you do is you turn the defibrillator on and simply follow the instructions. Going to need a bare chest. Put the pads on the chest as the pictures show. One pad goes upper right shoulder, the other pad goes lower left of the chest. You want to make sure the area is dry. Most important thing to remember is to stand clear of the patient when it's analyzing and when you're going to press shock. So one pad goes upper right shoulder, the other one lower left side of the chest. Defibrillator is saying to stand clear. It's analyzing what the rhythm is, whether a shock should be given or not.
Analyzing the heart rhythm. Shock advice. Stay clear of patient.
The defibrillator's advise a shock. Make sure everyone is clear. Press the lit up button and then continue compressions. It's 1 compression for every 2 minutes. Sorry, 1 shock for every 2 minutes of compressions. 1 shock for every 2 minutes of compressions. After 2 minutes, the defibrillator will tell you again to stop. It'll analyze. It'll either advise a shock or not. If your patient is not showing signs of life, even if it says don't shock, you will continue then on with your CPR for another 2 minutes. It'll then analyze again, either shock or no shock, and then continue with CPR once again. Jack, over to you.
Thanks very much. So just to reiterate some of those key points that we've just discussed, if you come across a person and they're not awake, they're not conscious, they're not responding to you, then that means that they're unconscious. We then need to check if that person is breathing normally. Now, the really important thing here to understand is that sometimes even in cardiac arrest, there is still some sporadic movement or very shallow and brief movement of the chest. So the assessment that you're making or what you're looking for is for normal breathing with good chest rise and fall that's happening regularly. And if you don't think that that's happening or you're not sure, then the safest thing to do is to start our call, push and shock program. So the first thing to do is to call for help, contacting 000, contacting Hatzolah to get a responder to come to your location. Once you know that help is on the way, begin with the pushing on the chest, which is those compressions, hard and fast. And then if a defibrillator is available, we follow the instructions that the defibrillator gives us to deliver a shock and hopefully restart that person's heart. So that's the key point of what we're trying to get to. It's not hard and we don't want people to be afraid of it. It's very simple. A person who's not awake, not breathing normally, call for help, start pushing on the chest, and if a defibrillator's there, bring it to the patient and follow the instructions of the defibrillator. We really hope that as many people as possible feel comfortable stepping up in a time of need. If you witness a cardiac arrest or you think someone might be in cardiac arrest, we really want as many people as possible to step up and follow these actions, because as we saw from the videos at the start, we know that those are the things that can save a life. I wanted to share briefly with you a little bit of information tonight about our Good SAM app. So Good SAM is an application that we're using here in Victoria, and just like the G-PAP, it's available on the App Store and Google Play, so you can download it to your phone. And Good SAM is all about connecting people who know how to perform CPR with the patients who require CPR. So whenever someone calls 000 for an ambulance, at the same time as an ambulance being sent, we're also activating any nearby Good SAM responders. So these are just people out in the community like you or I who are at home having dinner or sitting at work. We become notified that someone nearby us and in the immediate vicinity is potentially in cardiac arrest. And Good SAM sends us an alert to the phone, tells us where to go, and then lets us implement the call of push and shock. So we attend, we make sure help has been called, we start that early CPR, and if a defibrillator is there, then we use it. So Good SAM really is about connecting the people who have got the skills to perform resuscitation, to perform CPR with the patients who need it the most. So you might be sitting at home asking yourself, how do I know if I'm ready to perform CPR or if I should download Good SAM? Good SAM is available to all Victorians if you feel comfortable with what we've discussed here tonight. So it might be that you've done a first aid course before, or perhaps your first aid course is expired, but you've recently done some CPR practice or you've seen some demonstrations and you feel comfortable with being able to come along and help try and save someone's life. If that sounds like you and you feel comfortable to assist a stranger or to assist a loved one in that type of emergency, then we'd love you to download the Good SAM app, to be registered with us, and then you're on standby if you are nearby to someone who needs your help. And as we know, those first few minutes that you might get there before anyone else is there to assist, they can be the most valuable minutes in saving someone's life. Now, just to make everyone aware, the Good SAM app is currently turned off due to COVID because we were attempting to protect people from exposure to possible COVID risk. But we're starting to turn that on today, tomorrow, in the rural regional areas. Good SAM will become active again. And we hope as soon as it's safe in Melbourne again to get people responding to these cardiac arrests that it will be turned on as well. So if we can ask one thing of you tonight, if you feel comfortable with providing CPR and with that idea of pushing hard and fast on the chest and potentially using a defibrillator, then please download this app and sign up tonight, because you never know, it could be tomorrow or it could be in a year's time that the app goes off and tells you that you're nearby to someone who needs your help, and the assistance that you provide could well be important in saving their life. So download the app, have a look, and if you feel interested and you feel comfortable, then please do register with us and be notified of times when we might be able to use your skills to help save a life.
The Good SAM app is available in Victoria and integrated with Ambulance Victoria's dispatch system to quickly connect patients with help in the vital first minutes of a cardiac arrest. Every day, 16 Victorians suffer a cardiac arrest in the community, like Jack, who has suddenly collapsed at home and stopped breathing. His best chance of survival is if CPR is started immediately and a defibrillator is used as soon as possible. Time is critical as Jack's family call 000 for an ambulance. The call taker immediately dispatches emergency services and guides Jack's family to provide CPR while paramedics are on the way. At the same time, nearby Good SAM responders receive a phone alert that Jack needs help. Zoe, an off-duty lifesaver, and Max, a qualified first aider, both accept the alert. Good SAM directs them to Jack's location and where to find the nearest registered defibrillator. Zoe and Max arrive within minutes and perform life-saving CPR and defibrillation until emergency services arrive. Paramedics provide advanced care to stabilise Jack and then transport him to hospital. It takes a team to save a life, and Good Sam brings our community closer when someone needs urgent medical help.
Terrific. So there's a nice little summary of our Good Sam app. If you or someone you know are interested in using the app, you feel skilled, then please do jump on and download it. It's already been proven to have saved many lives here in Victoria, and we know that with more responders on board, we can do even more great work. The last really important message that I'd like to stress to the community tonight is the importance of AED registration. So an AED is an automatic external defibrillator, and it's the device that you saw before that can help identify the electrical activity in the heart and restart a heart to be able to start beating again on its own. So AEDs are a very life-saving piece of equipment. The great news is that over recent years, we know they've become more affordable, and all sorts of community grants and donations and things like that have made AEDs a really prominent part of our community. So we know that there's lots of AEDs out there, and it's good that we've got those out in the community, because accessing one of those and applying it to the patient and following the steps from the AED is really important, and if done before the ambulance arrives, it can save a life, and that early defibrillation can really make a huge difference. The AEDs are very simple to use. There's a reason that the first letter is automatic. You just follow the instructions and the pictures that come with the device, and it'll step you through everything you need to do. So it doesn't matter if you've never seen one before or if you've done training with it 100 times before. It's a very simple device to use. You can't go wrong with it, and it will potentially save someone's life. But what we know is that we've got lots of these AEDs out in the community, in different community groups and churches and sporting venues and all sorts of different places across Victoria and across our local community. But what's really important is that when an emergency comes up, we have to know that the AED is there and available to be used. And so obviously, if you've got an AED and it's within your workplace and someone in your workplace needs it, then that's great. You're likely to know that you've got one. But what would you do, say, if the person in the workplace next door to yours or someone out the front of your business collapsed and needed an AED? Well, you won't always be aware that your AED could be out saving a life at that point in time. So what we're encouraging you to do is, if you own a defib or if you know of a defib that's located somewhere within your community group, we're encouraging you to jump onto our website and register that device. What that does is it adds that AED to our registry, to our collection of information about where all these devices are. And through the Good Sam app, when a cardiac arrest occurs or where we think someone might be in a cardiac arrest, we can actually make sure that that defibrillator is able to be accessed, brought to the patient and then used to save minutes before the ambulance gets there and to really boost the chances of survival for that individual. So if you know of an AED or perhaps you own one, can you please consider registering it? If it's ever used as part of an Ambulance Victoria deployment or usage activation, then we will come and support you to make sure that that defibrillator is returned back to a serviceable condition, and we'll work with you to make sure that, that those things happen. So really this is about making sure that every machine that we've got out there in the community can be used in the time of an emergency. So if you know of one, please jump onto the website, register your AED, let us know that it's there, so that when the time arises for it to be used, we can make sure that it's definitely got the best chance of being accessed. Beautiful. Well, it's been a great session tonight. Thanks very much for tuning in to the content that we've provided. Just to really reiterate the key messages that we've talked about tonight. Community education that we're providing through this Shocktober campaign is really aimed at encouraging everyone in the community to become involved in saving a life. And so what we've asked of you tonight is some very simple things, and hopefully we've given you some information to make it understandable and easy for you to provide. If you see someone who's collapsed and they're unconscious and you don't think that they're breathing normally, then please don't hold back. Jump in and use the call, push, shock algorithm or method that we've talked about. So call for help straight away, start pushing on the chest hard and fast, and if there's a defibrillator available, bring it to the patient, follow the instructions, and you could potentially save a life. I know we've had some great questions come in while we've been on the session tonight, and I've got John and Leon have come and joined us up here, and I thought maybe, John, do you want to talk us through any of the questions that have come up tonight?
Thanks, Jack. I've got some great questions here. First one, probably a question for you, actually.
Right.
So what causes cardiac arrest?
Great. So just to, I guess one of the common misconceptions is the difference between a heart attack and cardiac arrest. So a heart attack is when the heart, the blood supply to the heart is interrupted and the heart starts to be distressed. But the heart's still beating at that point. So the heart's not very happy with us, but it's still beating at that point in time. A cardiac arrest occurs when the heart stops beating altogether. So there's no blood being pumped out by the heart. So a cardiac arrest is much more severe than a heart attack. There's all sorts of number of things that can cause cardiac arrests though. What we know is that out in the community when these things tend to arise, it's often due to a heart-related issue like a heart attack that's occurred some time before. But there's all sorts of other things we know, that sorts of trauma and breathing issues and all sorts of things can lead to a cardiac arrest. So there's any number of causes, but most commonly out in the community it is due to a faulty ticker.
Okay, thanks. Another great question here. So obviously they've been listening about the need for a defibrillator or an AED. And the question here is it recommended to have a defibrillator in one's home? And if so, where should I get one?
It's a good question.
Great question, isn't it?
What do you think, Leon?
I think having one in every home is maybe a bit of overkill, bad choice of words, but is a bit excessive. I think having solid training in CPR, making sure that you can recognise a cardiac arrest straight away and call for help straight away, giving a clear location, is probably more on the reasonable side.
Yeah, and definitely, I guess a defibrillator, the automatic defibrillator, is still up in the couple of $1,000 sort of range. So they're not, they're not affordable for everyone to have in their home, are they? But I have been to people who know that perhaps they're particularly high risk. They've had a lot of heart problems in the past, and maybe they've even had a cardiac arrest once before, and so they've trained the loved ones in the home, and they do have a defibrillator there. But I think, as you said, Leon, until the defibrillator is a little bit cheaper, probably learning CPR and being ready to go with the CPR and calling for help is the more important step.
I happen to know there is technology out there that's making them a lot smaller and a lot more affordable, but that's so we have to keep our eyes open for that.
We'll just hold the iPhone up to you in future, John, and it'll do everything.
Next question. I think it's another one for you, Jack. Is there an age requirement for Good SAM?
Yeah, so we do ask that all of our responders are over the age of 18. That's because when you get a notification on Good SAM, what would happen is that we're potentially giving you the address of someone else's home or all sorts of different locations. So we need people that are adults and able to go into homes and things like that. But definitely be aware of it for people in that sort of 16 to 18-year-old group. And once you become an adult, we'd love you to sign up. Thank you.
Leon, I think this one might be good for you. Do I need to be AED trained to use a defibrillator?
No, you don't. So they give really clear instructions, but of course it always is better to do a CPR course and to be trained. But certainly if you're in a situation where someone suffers a cardiac arrest, they're not showing signs of life, call, push, shock, follow the directions on the AED. And the other thing is when you do call, when ambulance do get in touch with you, they're going to guide you through CPR as well.
Right, we're getting questions thick and fast, which is great.
We'll be here all night.
I think this is a really good question too. So, because it was a question in my mind as well. So, what about checking for blockages in the mouth and throat, etc., and doing mouth to mouth? Does that still play a role currently?
It is a really good question, and certainly for those who have done first aid training before, you might remember over the years we've had all sorts of different versions of resuscitation. I guess the important thing to remember is that, as we mentioned with the very first question, the most common cause of cardiac arrest is something to do with the heart, with the heart not being able to pump effectively. So obstructions in the airway and those types of things, although they happen, they're pretty rare. And so really in terms of actions for the layperson, for people at home in the community, the most probable thing that you're going to need to do is push on the chest to get the blood pumping again. And we know that when people suffer a cardiac arrest, there's already a little bit of oxygen still in the system that's enough to go around. So doing things like the breaths and looking for obstructions, if you're trained and you're comfortable to do those things from your first aid training, absolutely. But if you just turn up and a bit surprised by the whole event, the best thing you can do is to start pushing on the chest, and more than likely you'll be doing a big favour for the person.
But just a quick jump in. So ultimately, the organ that we're trying to save and that's most critical is the brain. And it's the brain that doesn't last more than 3 or 4 minutes without oxygen. When the heart's not working, the brain's not getting oxygen. So the first thing we need to do is keep that blood circulating. And like Jack said, there's already oxygen in the person's body at that stage. The other thing is when you're jumping on someone's chest, they are getting some oxygen through that as well. But speaking about breaths and COVID, there's no breaths now, and remember to put a mask on you and on the patient.
Yep.
Great point.
Thanks, Leon. Next question, Leon, perhaps. Where can I get some training in CPR and what's the cost? Now, that's also subject to our current COVID restrictions, but nonetheless.
So we're very restricted at the moment with the face-to-face training we can do. But certainly get in touch with us. Happy to do accredited training when things open up again. The costs for CPR training are very reasonable, and give me a call and we'll have a chat.
Okay, thank you. Jack, another one for you, I think. How do I respond to the patient if they become conscious and then suddenly react and become scared or frightened because all of a sudden they realise that you've been working on that patient? So how would you handle that to ensure that your own safety and indeed keep them safe?
Yeah, so we know that anything in the medical world is danger is always our first concern. So there is a chance that by using the call push shock pattern, perhaps you're finding someone who's actually not in cardiac arrest. They might have just had very shallow breathing, or it might just have initially seemed like they were in cardiac arrest. And then when we start those compressions, we get a little bit more of a response. It's not an uncommon thing to happen. So if that does happen, what we would advise is that if it's not safe, remove yourself from the environment. You can always provide information to emergency services from a safe distance. And if you see them collapse again, then just take care and see if it's appropriate to reapproach.
Okay, thanks. This is a good question too. It's some great questions tonight. Can I get into trouble if I use the defibrillator and then do CPR, but the person doesn't survive?
Very good question. So defibrillators, as we said, they're made for the lay person. And although we know that using a defibrillator will increase the person's chance of survival, it's not a guarantee that every person that we get the defibrillator to is going to survive. So although we hope for a great outcome with these things, it's certainly not it's not your fault if that doesn't go our way in that particular case. Not everyone will survive these types of events, but we want to boost their chance as much as we can. And
you also have the Good Samaritan Act and common law, which protects first aiders. Just stick within your training, so don't use your foot to do CPR. The other thing is the defibrillator won't fire off if it's not meant to, so you don't have to worry about defibrillating. And I guess the other thing with CPR is, or with a cardiac arrest, is that the person in that state will not survive. If you don't do anything, they will not survive. They're already on the other side, and you have a very small window of opportunity to perhaps bring them back. So that shouldn't be a concern.
Great.
Okay. Can I accidentally shock myself?
Shock yourself. Yeah. Used to be a big worry, didn't it? And still is. You know, we obviously want people to be safe around the use of the defibrillator, but the devices these days, the technology has come such a long way that we know that they're very safe. And even in our ambulance practice now, sometimes occasionally someone might still have contact with the patient. We know that they don't suffer any harm if it's just by that accidental contact. So they are a very safe device.
So some great questions, but that seems to be all of them for the moment. So for those who put questions in, thank you. They were great questions.
Thanks very much, everybody. And I guess just in summary, it's a great opportunity to thank our friends at Hatzolah, Leon and John, and the team who have put on the webcast for us tonight. It's been excellent. We've really enjoyed the opportunity to come and speak to you all in your homes this year as part of our Restart a Heart Day, and Shocktober is our community education campaign. So hopefully you've learnt something from tonight, and hopefully you feel prepared so that if you do see someone that you think might be in cardiac arrest, you can follow these steps: the call, push and shock, and maybe save a life. Thanks for joining us tonight, everyone. It's been a pleasure.
And to Jack and the team, thank you.
Terrific.